The BBL, or Brazilian butt lift, is probably the plastic surgery procedure that has been getting the most media attention in the last few years. I guess the Kardashians and Instagram have brought the body part of the buttock really into the spotlight. So what exactly is a BBL, or Brazilian butt lift? It's actually a liposuction procedure where we remove fat from certain areas of the body, often in the waistline and the trunk area and the abdomen, but it can actually be from anywhere. And we use that fat to augment the buttock. So we use some of the fat cells that we harvest during liposuction to round out the bum and also to increase the volume of the bum. The general goal is to improve the silhouette, to give a nice hourglass shaped silhouette, and to narrow the waist as much as possible to give a nice small waist, and to amplify the hips and the buttock area. Important to note that it's not a skin firming procedure, so it's not like going to the gym and getting muscles in those areas. It's to fill out the areas that you feel you might be lacking a little bit in volume. So your skin quality will stay the same, the texture of everything will stay the same, but your silhouette will be greatly improved. And it helps a lot with just wearing clothing. Your pants end up fitting a little bit better because they're less tight at the waist and more tight around the bum. So it's easier just to put on your pants, and even in a dress, you're gonna have a nicer silhouette in there as well. In terms of downtime, it's a liposuction procedure, so it can be done under sedation or general anesthetic. And it really depends on the patient's health and also how much fat we're gonna be removing. A BBL procedure can be a relatively small one where we're moving around a liter or less of fat, and it can go up to something 5-6 liters of fat can be removed during that procedure, and using significant volumes to increase the buttock size. How long it's going to take for you to recover depends, but after 2-3 days generally you're able to shower, and after 2-3 days you're generally able to get back to normal light activities. If you're doing sports or any type of physical activities, 2 to 4 weeks depending on the patient, depending on their swelling, and just generally depending on how they recuperate. It's case by case and patient by patient, and it's many different procedures into one. So when we evaluate the patient, we look at areas that we can take the fat from and that will most improve their silhouette.